Wena bekunene siyakwamukela sibonge isikhathi sakho. If you can give us an overall picture in terms of eSwatini's efforts to battle or to fight rather COVID-19, how would you say you're faring?
I would say we are doing fairly well. Not too good. We have numbers at this point. We have 840 tested positive to date. So we have 11 deaths, which is really unfortunate. But most of those had comorbidities. I think we have 9 men and 2 women that have passed on. We have 418 that have recovered. But overall, we are, as a Ministry of Health, trying to increase our bed spaces. We have one hospital where we are now increasing, constructing a ward for 104 patients. We have increased bed spaces by 126 beds recently. So we are on track on that one. We are also looking at increasing the number of health workers on the ground. Government has very kindly allowed us to keep increasing these numbers, but because of the many clusters that are coming up in different areas and different regions, we need to increase and increase rapidly. So we're in the process again to look at community level workers as well as other health workers.
You mentioned
I think,
please continue your thought.
I was just saying, I think we are anticipating a drastic increase in this in number of positive cases this month. In the month of July, we will be opening schools next Monday, but we're only opening for grade 12, which would mean we're allowing grade 12 to finish their high school and write their exams. But that means that there's about 15,000 students in all regions of the country. So there will be a lot of movement of people, a lot of demand on public transport as well. So we anticipate that by the end of June, we'll probably have our highest number.
What is informing then the decision to reopen schools for grade 12s if you're anticipating higher numbers? We also understand that unions, especially the Swaziland National Association of Teachers, is opposing this move. What has been the level of engagement with them?
We've been engaging with the unions from the very beginning of the discussion on whether schools should open or not. We have worked with teachers, we've worked with the unions in terms of training. The Ministry of Health has been leading the training on COVID and what readiness would look like for schools. So we've been working very closely with the Minister of Education. The dissent in thought with the unions came very recently, but just this week, teachers went back to school, teachers were cleaning their own schools, teachers were marking for social distancing in nearly all the schools. So it looks like teachers are geared up to going back to school. So there's a whole team of cabinet ministers and MPs that are literally just inspecting schools to check the readiness this week.
With the 11...
But all in all, I think...
I beg your pardon, please finish your thought.
I was just saying, all in all, it looks like teachers are ready to go. At the beginning, we're all in agreement with the unions. I mean, they need to continue conversing with the teachers because teachers are in school as we speak. A lot of teachers are busy getting the schools ready.
Are you worried, as you mentioned a little bit earlier on, that you are expecting the numbers to rise or expecting to see more cases in terms of infections? Are you worried with schools being reopened?
Of course we're worried. We are worried because we know we're dealing with young people here. We're dealing with a large number of people moving at the same time. We're dealing with a high demand on public transport, and the likelihood of those keeping the 70% capacity, is questionable because we know that the children who have been staying at home and learning from home, going out there, some of them will definitely contact COVID. So it is how we control the spread, but we are worried. We are preparing for it, but it doesn't stop us from being concerned about it.
With the 11 deaths that you spoke about, you say that 9 are men and 2 are women. What does this tell you? Does this mean that men are at higher risk of contracting COVID-19?
Not necessarily. The numbers are too small for us to come to a conclusion like that. What we do know is that a number of these people that have died have had comorbidities, particularly diabetes, and sometimes combination of diabetes and vascular diseases, heart diseases. So it is, I don't know at this point in time whether it would be safe to say perhaps women seek help much faster than men. So that the men are turning out just a little bit late in the process. I cannot say that conclusively, but the numbers are too low at the moment for us to come to that conclusion. But certainly most of the men that have died have had diabetes, have had blood pressure.
What informed the decision to ban the sale of alcohol in eSwatini?
It was a number of issues, really, but most of it was partly because we see a lot of clusters coming up, particularly around Manzini, which we now see as our epicenter. Not nearly all, but a lot of the clusters that are coming up with infections, there's alcohol involved. And after alcohol was reopened, there were more of these, like small fires everywhere, of clusters of people that are where they are alcohol related. I mean, we know all the other problems with alcohol, but it was mostly that. And I think from the time it was open to the time we began to see the results of the days from the first day it opened, we had the highest numbers of people per day. I think we had 51 in one day, and the following day we had 42, we had 38. So those numbers were saying to us that, we needed to do something about it.
Are you able to share with us in terms of testing and contact tracing what progress eSwatini is making?
Yes, certainly. I mean, we were lucky to be able to develop our own laboratory in the country with the support of South African WHO, of course. But we're now able to test nearly 400 a day. For us, that is major progress. Last night, for instance, we tested 402. So we're able to test that much. And that means that the turnaround time is much quicker. We recently have had a backlog, and that was due to the fact that we didn't have the semi-automated test kits. We're using manual test kits, but we now have new stock, and we're moving ahead. And I think that speaks to how quickly we can give feedback to people, how quickly it fits back into the system for us to be able to plan properly.
A final thought from you in terms of quarantine sites and facilities. Is this something that eSwatini is looking at?
We are quarantining people coming in from outside. We still have a small movement of people coming in from outside. We've had students repatriated from the US, from Europe, from Russia, and those, when they arrive, we quarantine those directly. We've had also people coming to quarantine. But generally, with the public, we are encouraging people to self-isolate at home where possible, particularly while waiting for results. But as soon as people test positive, we start treatment. Whether people are asymptomatic, we've increased hospital beds for that. We, in fact, created a space where it used to be our treatment center. We created a space for 126 beds. So most of the very mild and the asymptomatic, we admit there, we look after them there, we try and prevent the disease from settling in their bodies, and we see a lot of recoveries there. And the more moderate and severe illnesses to the referral hospital that we set up for COVID response from the very beginning. So in terms of contact tracing, I think we are getting most of our cases from contact tracing. From what we are seeing quite clearly, the contact tracing is working. We have a lot of contact tracers. We're trying to increase those numbers on the ground to make sure that we can catch every cluster that develops, and we can try and curb the spread, especially in Manzini.
Ngwane sibonge kakhulu. That was Mamlizi Nkosi, eSwatini Health Minister.